If you're over 40 and you've ever wondered why your skin feels drier, less firm, duller, it's not just aging, it's estrogen withdrawal. And that leads to collagen loss. There are two ingredients out there that promote collagen and estrogen in the skin. You have your topical soy-based isoflavones such as genistein, and then topical estriol and estradiol. But is one better than the other? I'm going to get into the science of how both of those ingredients work, safety, patterns, um, efficacy, and hopefully help you decide which one is more beneficial for you. Starting around age 35 and really peaking after menopause, we start to lose collagen due to estrogen loss. So in the first 5 years after menopause, we lose 30% of our collagen, and that leads to significant changes on your skin. Your skin gets drier, more sensitive, duller, and less thick. You lose elasticity. So all sorts of bad things happen to your skin as you lose that collagen, in relation to like estrogen decline. So estrogen binds to estrogen receptors, and in the skin, those receptors are in fibroblasts, keratinocytes, and sebaceous glands. And then once the estrogen binds to those receptors, you have, when it comes to skin, you have production of collagen 1, collagen 3, um, better elastin function. You also have more production of ceramides, hyaluronic acid, better antioxidant defenses on the skin. So estrogen is really important in keeping your skin healthier and more youthful. But can you stimulate estrogen receptors from the outside with just topical products? So the answer is yes. And there are two ways to do that. You can do it through topical estriol or estradiol, which are natural estrogen like molecules, or you can do through soy-based isoflavones such as genistein. So if I were to summarize changes triggered by estriol versus genistein, when it comes to collagen production, you know, estriol is going to produce more collagen than genistein. Maybe estriol is a 4 out of 5, genistein is a 3 out of 5. When it comes to safety, of course, genistein is completely safe. It's not a hormone. There's no systemic absorption. With estriol, there is potential for systemic absorption, which could be an issue in people that have estrogen dependent or aggravated conditions such as certain types of breast cancer, blood clotting disorders. And estriol is way more regulated because of that. So it only comes as a prescription versus, genistein you can get in over-the-counter preparations. And then the other, I think, differentiating factor that we want to mention is pigment induction. So genistein actually, if anything, is anti-inflammatory. It may even decrease pigment to some extent. Estriol can aggravate people pigmentation issues such as melasma. So my recommendation is to choose genistein if you're looking for something that promotes some collagen, but is also anti-inflammatory, which can also help with redness and irritation of the skin. You want to avoid any safety concerns of long-term use. so genistein can be used safely long term. It may be a particularly good option for people that are younger, 40s, 50s, that haven't had a whole lot of estrogen and collagen loss yet, as a mild collagen promoter, or for just long-term use for people that are already on HRT and don't want any extra hormonal issues, and people that have estrogen you know related issues such as breast cancers, they're estrogen driven, or blood clotting conditions. Um, Also, the best choice if you have the combination of melasma, rosacea, because it can, in a way, help with those. Where I would say estriol would be beneficial is for women that have significant collagen and estrogen loss postmenopausally and want some estrogen effect on their skin, um, without getting on HRT. So it's a good option for people that are not going to be on HRT. And if you are on HRT, like I said, I think genistein is a safer option to decrease high levels of estrogen in your systemically. Um, and estriol, of course, is also a good option um, for women that don't have any history of estrogen dependent issues such as breast cancers. So it's definitely the more potent estrogen stimulator. But with that, it comes with more risks than, genistein. So my verdict is um, estriol is the more potent sledgehammer when it comes to promoting estrogen. Great for people that are very estrogen, deficient postmenopausally and are not on HRT and don't have any history of breast cancer or any, estrogen, impaired issues, and also don't have a significant history of melasma, which will be aggravated by estriol. Genistein is, though, the one that may be the most beneficial for most people. It's great for younger perimenopausal, early postmenopause women that don't have like significant collagen and estrogen loss yet. Um, because it doesn't have any systemic effects. It can be used in combination with HRT in women that are already on that, and it works well as part of a complete collagen promoting regimen that could include peptides, retinol, vitamin C, all these other ingredients, or in office treatments. So I'm a huge fan of genistein. It's natural, safe, promotes some collagen. It's also anti-inflammatory, gives you more brightness, and that's why one of our products has the genistein. So our Phytoestro Age Eraser is this one complete product that you may be looking for. It has genistein, but it also has um, quinatin, which is a natural growth factor. It has vitamin C, ferulic, vitamin E, which promote collagen. It also has a good peptide combination that promotes collagen, and ceramides and hyaluronic acid to keep your barrier nice and healthy. So I love that product. It has the genistein, which, for me is my favorite ingredient, especially because I have a little tendency for melasma, and melasma is so tough to treat. So that would be my recommendation. Genistein versus estriol, probably genistein would be my choice. So I hope you found my video useful. If you want more videos like this where I explain ingredients, and skincare and different conditions that happen as you age, subscribe to my channel.